This is 7 National News, and in our top story, President His Highness Sheikh Khalifa bin Zayed Al Nahyan has ordered the allocation of 36.6 million dirhams in aid of people affected by floods in Malaysia. Sheikh Khalifa's initiative will help provide aid to more than 20,000 families in various areas affected by floods, which destroyed the homes and properties of many Malaysians. The Emirates Red Crescent will implement this humanitarian initiative by reconstructing and renovating more than 20,000 affected homes. As part of the President's gesture, the ERC will also provide the necessary and basic needs for the new homes. The items will be brought from the Malaysian local market. A total of 100,000 Malaysians will benefit from the initiative, allowing them to return to their homes. A convoy has already been sent to Syrian refugees in Jordan on the first day of the aid campaign launched by the UAE on Thursday. According to local reports, the UAE's collection of more than 120 million dirhams in 2 days will help ease some of the sufferings of Syrian refugees. However, addressing their need in this time of conflict requires far greater donations, according to a senior official. Rashid Al-Mansouri, Deputy Secretary General for Local Affairs at the Emirates Red Crescent Authority, was quoted in a local daily saying that in a few more days, a fleet of trucks will carry the rest of the items and funds. He continued to urge UAE residents to continue their generosity and make regular donations to aid the displaced Syrian peoples. According to the latest United Nations estimates, more than 2.3 million people have fled Syria since the conflict erupted in 2011. They are now stranded in temporary camps in Jordan, Lebanon, Iraq and Turkey, where living conditions have deteriorated even further due to the snowfall and severe winter. In a bid to create and sustain a healthy lifestyle among school children, the United Nations Children's Fund has launched the School Health Education Project, which will run in 18 government secondary schools across the UAE. During a press conference today, officials from UNICEF introduced the pilot program in collaboration with the Ministries of Health and Education, along with SIHA Ambulatory Health Services and DO, which aims to increase awareness on the benefits of adopting a healthy lifestyle among the youth. Among the officials speaking at the conference was His Excellency Nasser Khalifa Al Budoor, Director of the Dubai Medical District and the Director of the Minister's Office at the Ministry of Health, who stated that such programs are vital in increasing and developing knowledge on these issues and further enable students to make healthy life choices. According to officials, the School Health Education Program will run for 1 year, where school nurses will be trained to deliver skill-based health education sessions for those aged 12 to 15 years. Officials added that obesity and addiction to tobacco is one of the issues affecting this age group, which the project also aims to address. Dr. Ibrahim Al-Zik, Gulf Area Representative for UNICEF, stated that through discussions with nurses and data collected, they aim to formulate a guide for the delivery of health education workshops, which will be shared with the Ministries of Health and Education and eventually put forward for all government and private schools across the UAE.
The idea of this project is to work with 18 schools within the Emirates, 8 Emirates in the UAE, and bring on board the school nurses and also the children and their parents, and have a focus group discussion with them to look at what their concerns, how we can help them, what are the tools they require to enable them to change their behaviors. Some of it might be educational, so it is knowledge. Some of it might be skills, then not right skills to actually do change their behavior. And then we will pilot this in 6 months' time. So if we feel that after the pilot we are able to reach our targets, then we scale it up throughout the Emirates. So we'll cover all the government schools, and then that will start seeing the dent. We can start seeing the results because it's all scaled up throughout the Emirates.
There is challenges in everywhere, and the healthcare, we believe that the healthcare is a long journey, so it's not a short trip. It's a long journey, and I'm sure the result will be very clear in the long term.
Top officials from Dubai Police revealed on Sunday that 115 million dirhams worth of drugs were seized in the Emirate in early October. According to a local report, police have stated that 4.6 million Captagon pills were seized in Al Awir during a police operation in which 3 Arab suspects were arrested. Police are hunting for 2 other suspected gang members, also Arabs. Major General Khamis Matar Al-Mazaina, Chief of Dubai police was quoted as saying that the police operation was one of the first of its kind in the country and a major one on the global level, according to the Regional Office for Fighting Drugs and Crimes in the GCC. And with all roads leading to Dubai's Palm Jumeirah this New Year's Eve for the biggest fireworks display the world has ever seen, organisers have announced that access to the man-made island will be limited. Organisers of the Dubai World Record 2014 have confirmed on their official website that residents, guests and people with special passes will be allowed on the island at certain hours, with access on the Palm closed post 10:30 p.m, citing safety reasons. As Dubai attempts to break the Guinness World Record for the world's largest fireworks display on December 31, with a 6-minute display choreographed across the whole of the Palm Jumeirah and the World Islands, organisers of the Dubai World Record 2014 have posted details on the official website on accessibility and how people can reach their destinations on the night. The organisers have also stated that the monorail will be closed from the 26th of December until the 2nd of January. And finally this evening, a new study has found that travelling keeps you young or at least healthier. The study has linked travelling to decreased risks of heart attack and depression, and even the promotion of brain health. The Global Commission on Aging and Transamerica Centre for Retirement Studies, in partnership with the US Travel Association, has released research that shows travel offers the same sort of physical and cognitive benefits as crossword puzzles or museum visits. According to the study, women who vacationed every 6 years or less had a significantly higher risk of developing a heart attack or coronary death compared with women who vacationed at least twice a year. Men who did not take an annual vacation were shown to have a 20% higher risk of death and about a 30% greater risk of death from heart attack. Meanwhile, the benefits of travel are almost immediate. After only 1 day or two, 89% of respondents saw significant drops in stress.